Hi, everybody. My name is Libby Sagara. If you haven't joined our Central Valley eConsult Coalition roundtables in the past, I'm with LUPAC Health and I facilitate our group. We appreciate your taking your lunch hour to join us. I know you're all very busy, especially those who are sitting at clinic sites. We're thinking of you all as we know this is a tough time, a very busy time for you all. We gather on a monthly basis, as you know. We like to share some activity updates, what's happening at your clinic sites, and just any new and exciting stories around eConsult. We are happy to have both speakers from Anthem and Calviva on our call today who will share some of the planned perspectives around eConsult. And we're pleased to have featured speakers Petra Steinbushel and Michelle Riederer from the UCSF Benioff Child Psych program. We're going to be talking about an exciting announcement around eConsult and phone consult access through a hybrid program. Also, wonderful announcement around expansion of access to eConsult for uninsured patients and opportunities for providers to achieve free CME for behavioral and mental health. So we have a lot of upcoming activities that we'll be able to share with you today. So what we like to do at the beginning of each of our calls is just look back on what's happened in the past month. And we know many of you are using ConfirmEd for eConsult. Some are also using Rubicon MD. We like to look to see what's happened over the past month in terms of volume by specialty. Here's a quick little snapshot of what you can see has happened over the past month. Specialty volume obviously shows that we have scarcity in some key specialties across the Central Valley. Neurology, ortho, cardio, GI, always high on our list. We're seeing great use of dermatology for eConsults. And we've also heard a lot of recent need around behavioral and mental health, what we're going to focus on today. As you all, if you've been involved in our roundtables in the past, you've also heard that we've had a recent focus on pain management. We know back in spring, there was a pain management clinic closure. So in response to that, we made sure that we could focus on how to provide tools for you all as clinics to achieve access to eConsults for pain management. So we thank you all who've been involved in us in our coalition from the beginning of the year. We are every month adding new providers to our group. So we're pleased to have a few new providers on our calls. Now we have King's Winery, who's joined us recently. Valley Children's, I know you've been on for the past few months, but Valley Children's will soon be active, if not active already in eConsult. We also have St. Agnes Medical Center as a newer member, a newer participant in our group. If you are not listed here, if you're a provider, group, or clinic who's participating in our group, and wait, I don't have you listed on our list, please just take a moment, introduce yourself in the chat. We'd like to make sure we know who's on our calls and engage you in our future communications. So with that, any announcements, any words that you'd like to share from the leadership perspective? I know we have Mark Schweier from California Health and Wellness. We have Jeffrey Nikonsa from Calviva, and we have Karina Mendoza from Anthem leading our projects. Karina, do you have anything you'd like to share as we get kicked off here?
Just thought it's great to see the engagement and utilizing the eConsults and all of the health centers that are joining in and participating in this effort to expand specialty care access. It's really great to see. So thank you to all on the call today.
Thanks. Jeffrey, anything you'd like to share? I'll let Jeffrey get off mute. And Mark, any words you'd like to share in response to what you're seeing here?
Thanks, Libby. Yeah, my excitement and just really enthusiasm about this effort has really just been sustained throughout the whole experience. I really appreciate the folks that have joined, the groups that have joined. We think the eConsults are particularly valuable now, especially with the COVID continuation of the COVID PHE. And I just really appreciate the engagement of organizations coming in to consider the value in their own organizations. Thank you.
Thanks, Mark. And those who are new to our group, please do take a moment, use the chat to introduce your organization. As we have our presentation today, we'd also appreciate any chat questions for our presenters. We want to keep this an open communication and an engaging conversation for you all. Karina, I know you want to say a few words around Hispanic Heritage Month. Go ahead.
Yeah, this is Karina Mendoza speaking with Anthem again. I did want to just acknowledge and take a minute to, or I'm sorry, take a minute to acknowledge all of the Hispanic and Latin community leaders that we have on the call and who are participating in this effort to expand specialty care access. As we are all aware, you know, in the Central Valley, the population that is mostly served is Latino and Hispanic. So did just want to take a moment to acknowledge that. And even if you go back a slide and you look at the specialties that are being done, endocrinology is in our top 10 continuously. So, and when you look at the population that we serve, being Hispanic and Latino, diabetes is something that is a health concern for many and that are Hispanic and Latino. That's kind of like one of the top things that are continuously coming up for that population. So it's good to see that at least the e-consults are being done for that specialty and it stays in the top 10. So we can see that as a population that we serve with this, that it is making an impact as far as getting that population access to care. So thank you to everyone for participating in this effort.
Thanks so much, Karina. And we're going to take some time at the end of our call today to dig a little bit deeper into racial and ethnic data around this program and how it's impacting the Central Valley region. So thanks again, Karina, and thanks to the leaders of our project who are really pushing this forward and making this grow in our clinics. One reminder or one message that we like to share on our monthly calls is just how we can talk to providers around eConsult. I know many of you are leaders in your clinics. You might be part of a referral team. You might be a leader in operations of your clinic. We like to be able to talk to providers as considering eConsult as the first step to a specialty referral. So we know eConsults are not meant or are not ideal for every single referral that goes out from your clinic. So we hope that our providers can think of eConsults as appropriate for all non-urgent, routine, and non-procedural referral requests. So we want to make clear to our providers as they get on board that the primary care provider has that relationship and gets to make that choice as to what's best for their patient and what's appropriate for the patient and at the time the patient needs a specific type of care. So thank you for being involved and for engaging your referral teams in doing this and making this an important piece in improving access to care across the Central Valley. With that, I'd like to introduce our featured presenters. So Dr. Michelle Reeder will kick us off today, along with Dr. Petra Stambushel. And Michelle and Petra have been on our calls in the past talking a little bit about CAP, which is a child and adolescent psych portal initially launched for phone psych access for primary care providers in your clinics. We're excited to announce now that CAP will be accessible through both phone and eConsult. So I'm going to hand it off to the experts in this. And I think, Michelle, I think you're going to kick it off.
Great. Thank you so much, Libby. And it's wonderful to be back here with this group again. I see a lot of familiar faces who I've spoken with before. So I'm happy to be back again and just wanting to talk more about our new eConsult program and also review CAP and what we offer. So we wanted to start off just by, acknowledging the pandemic, COVID-19, and the significant impact that it has had on children and young people's mental health. I think this came up earlier in the call today, but there has just been such a tremendous negative impact on our kids and youth who have been out of school for 18 months, who have had their lives disrupted in a way that, we're not sure what the lasting impacts will be. And so this came out of the Little Hoover Commission in August 2021. And the report talks about just the tremendous impact on mental health that the pandemic has had. Next slide, please. And what we really wanted to highlight was that, in the report, they talk about the social isolation, disconnection, and significant loss of loved ones that a lot of youth have had to face throughout the pandemic, and really wanting to highlight that experts are warning of a looming tsunami of unmet mental health need among young people. Next slide, please. And so in light of this, significant need, which we know has existed for quite some time, and just this impending, increase in need for mental health and behavioral health services, the question sort of is asked then, how do we meet these needs? And so we also wanted to highlight that, there are a lot of challenges for families, which I'm sure everyone on this call is well aware of, in terms of accessing behavioral health and mental health care. And the Kaiser Family Foundation put out this report, which surveyed parents of young people in, this report came out in 2021, and it really highlights that a lot of the challenges in accessing care is that parents simply cannot find a provider. They don't exist, or they don't exist in the places where they're trying to, access care. Other barriers include, being too busy or not being able to get time off of work. And another significant barrier is the cost. Next slide, please. And so, this is sort of a dramatic way of highlighting, the need for mental health. But, with this analogy of the tsunami, what do you do when there is a tsunami? Next slide, please. The guidance is that, if there is an impending tsunami, you move to high ground immediately. As soon as it is safe to move, you go. You do not wait for the official tsunami warning. And so, we're really drawing on this analogy to kind of highlight how the needs are going to rise. They're already rising right now, and they're only, the need for mental health care and behavioral health care is only going to increase in the upcoming, years and decade, and that we can't sit back and wait for that need to grow. We need to do something to address it now. Next, please. Next slide, please. And so, one of the things that we wanted to highlight is just the importance of the medical home in the role that it has in addressing this need. And so from the AAP in 2002, the medical home is a model of delivering primary care that has a lot of benefits, including accessibility, being a continuous provider who's known the child or the family for, potentially many years, potentially generations, as well as being really family-centered, often coordinated within all of the different specialties, compassionate and culturally effective. And there are a lot of other benefits that aren't listed in this slide, including, traditionally there's some degree of stigma in terms of accessing, mental health care and seeing a psychiatrist or therapist. That does not exist as much for the medical home, and just the availability and accessibility of the pediatrician, often, especially in our more rural or kind of underserved areas, there aren't mental health professionals who are located there for the child to see, and who is really there is the PCP. And so this pyramid sort of highlights that, what we really envision as the frontline provider is the PCP, with kind of a graduated going up the pyramid in terms of necessity to see that mental health professional. Next slide. And so CAP arose from, this need to provide, increase access to mental health care through workforce development. And here we have a slide that sort of has a very nice quote from one of the doctors who is an early adopter of our program. And she says that CAP has really been there for her, particularly during the COVID-19 mental health pandemic, and that it's been really helpful. So I'll let you read that slide. We can move on. So again, to review, we've presented on our program several times, but we offer a multi-pronged approach to helping support primary care providers in being able to take care of some of the mental health and behavioral health needs of children. So the most important one that we have is this real-time direct connect consultation, or not most important, but rather sort of the first thing that we think of here is the consultation piece. Traditionally, we've done teleconsultations. So, you as a PCP may have a question whether the patient is in the clinic with you, or you've seen them already, or you're preparing to see them, and you can pick up the phone and access a psychiatrist, a child psychiatrist, within 5 to 10 minutes and have a conversation and get your question answered. We're also really excited to be launching a new piece, which is the e-consult component that will be integrating with the program here with ConfirMed. The other pieces of our program is we have a one-time second step psychologist consultation, which offers the opportunity for either PCPs or family members to get direct advice, often behavioral guidance on, a question they may have about how to, handle or manage certain concerns for their child. And then the other aspects are continuing medical education. So we offer a lot of CME events. We've had a series of webinars that we've been doing all on Zoom related to mental health and stress during the pandemic. We had a CME event last year in combination with the ACEs Aware program that was directly about how to sort of next steps in terms of ACEs screening and what to do from there. And then our website also offers a lot of resources, including, some scales, resources, books for parents to read, just a lot of information that both families and PCPs can access. Next slide, please. Consult. And then this slide is really to just highlight that, in our experience from enrolling practices and seeing practices start to utilize our service, that it's not always just love at first sight. And what I mean by that is, often, when we first present our program to groups or practices, there are a lot of questions that come up and a lot of doubt and uncertainty from PCPs about whether or not our program will really be useful. And so these are, taken out of some studies that have been done for a similar program called MCPAP that started out in Massachusetts in 2000. That has really been able to take off from there and has been quite successful and is now state funded. And they show that, initially when they kind of questioned adopters on how they felt about the service, often there were a lot of feelings of, this program is going to slow me down. I'm not going to have time to do this. I'm already doing a fine job. I don't have any questions. Or, this is kind of funny. This is going to drag me down like an anchor. It actually looks like after, adoption and utilization of our program, that often attitudes in PCPs change after they use it. And it ends up being sort of a process where they are actually able to utilize the program and find that it actually helps them speed up, that they become, more skilled and honed in being efficient in treating sort of a lot of the more mild to moderate and common sort of bread and butter mental health concerns for kids and teens. And, in one study, 86% of families actually expressed increased satisfaction with their primary care providers' handling of their child's mental health needs after the provider consulted with MCPAP. So we can see that it's both, the impacts are both within the practice and for the provider, but also greater in terms of patient care. Next slide, please. Okay. I'm going to hand it off now to Dr. Steinbushel to talk a little more about the e-consult piece.
Thanks so much for that great overview. And so here we want to think about this as a kind of continuum of behavioral health integration and how it's applied to kind of mild severity up to more kind of complex or intense or acute severity. And so on the left-hand side, things that can be useful for minor problems include self-management tools like apps and web-based services, and then progressing forward, that text messaging and other apps can be useful. And then moving forward, looking at digital therapeutics like online CBT programs, and then having next step decision supports embedded in the EHR. And then here is a place where e-consults can be profoundly helpful at having this consultation platform that really can support decision-making in primary care. And then as a next step, Project Echo telementoring, which we're also offering and will be expanding in terms of our network that we offer it to, helps PCPs be able to develop more skills and also receive embedded support that in turn improves provider well-being because they're feeling supported by their peers, supported by the subject matter experts, and also developing in their knowledge. And then as a kind of next step in that collaborative care models and more kind of co-located models that exist in a lot of the FQHCs can be a part of this. Also, like the phone consultation piece can be another component of this. And then of course, direct evaluation is kind of the highest level of intervention. And so we'll talk through, how e-consults can be in particular helpful, and then what are some examples of that, and then examples of the teleconsultation. Next slide, please. Here, so our training, we're really proud of having developed this Project ECHO telementoring program, and we are talking about subjects that are informed by our consult questions that we're getting. And so we're hosting trainings on back to school anxiety, on ADHD, depression, anxiety, specifically how to start SSRIs, and kind of pearls and caveats with that. And I love the logo for Project ECHO, that it's moving knowledge, not people. So you can democratize knowledge is another catchphrase of theirs that allows you to put that specialty expertise into the hands of many so that you can help many more people. And this was first developed at the University of New Mexico in the early 2000s around hepatitis care. And patients were so grateful not to need to travel many hours to a specialty center to get that specialty care. We've also hosted other trainings on mental health and well-being and around ACEs and trauma-informed care, and we provide support to providers who are screening for ACEs. Next slide. We can, I think, move on past this one. I think folks know that we have this Department of Healthcare Services funding that will go through the end of 2022. This is in partnership with Anthem, and really I want to give a shout out to Karina for being a huge help and supporter and partner in all of this, and also to the folks at CalViva that we just met with to help disseminate this. But we do have this limited funding through the end of next calendar year to disseminate our program into the Central Valley. And next slide, please. So here's how teleconsultations work. Basically, the provider calls and provides brief demographics either over the phone or can enter a request online. And the psychiatrist calls back, the consultation begins. And that's an exchange that is, based on need, can be very short or can be longer if there's greater complexity. And then after the consultation, we send back a letter summarizing the recommendations, and that can either be faxed or encrypted email. Some practices prefer one or the other. With the email version, you can kind of copy and paste the recommendations into your EHR. Next slide, please. And then this is, I think everyone is familiar with how the e-consults work, but that this can be done asynchronously, and not that anyone writes notes at 9 p.m., but for those who do, can enter in that order for an e-consult request. And then the psychiatrist reviews the chart and writes the note in the EHR within 48 hours. And when there is potentially greater complexity, their providers are welcome to call by phone as well if there needs to be further clarification. Alternatively, if there has been a warm line consult initially, then an e-consult might be a nice, easy follow-up to that, or they can be done, one or the other. Next slide, please. Here are some demographics of the patients that we've consulted with so far. This denominator is what is represented here in these statistics, but this was as of July 1st. We had 650 consultations. And then since then, we've had just over 785 consultations to date. And here are the kind of age, gender, race, and ethnicity demographics. And then in terms of the consultation questions, while the biggest number of consults with the primary question is around medication. We also want to acknowledge that a lot of what we do is not just teaching people how to prescribe medication. We want to think thoughtfully in partnership, what is really going on with this child, what other strategies may be useful. And as you can see here, treatment planning is often a secondary consultation question along with these others. Next slide.
Dr. St. I just want to stop for a moment, since I think that this slide is so telling. Some others out there might be parents of teenagers, but just looking at this large volume of teen questions, the questions around teen health. And I just think that this is very important, such a great resource to have. Have you noticed any sort of trends? Has this increased through COVID, that there's been more of a need for support for teens?
So great question. And we actually are coming up on our 2-year anniversary tomorrow. So, and we didn't have that many practices enrolled in September of 2019. So I think our arrival was kind of timely, especially as everyone shifted to more of a virtual and remote workflow. And that said, I think the complexity of what is being addressed and managed in primary care, especially amongst teens, when there is starting to be increased concern for depression, anxiety, in particular, loneliness has been such a significant factor in, development and mental health concerns these past 18 months. And now anxiety at kind of re-entering into school and other activities, but still amidst a lot of uncertainty. And, this developmental age group is already struggling with, I need to be social, I need to figure out my identity. And I do that in the context of relationships and not having that in the same ways. And then thinking about a lot of uncertainty around future, also increasing concerns about, climate change and wildfires. And this is an age when kids are really starting to become more aware of the world around them. Younger kids tend to just kind of focus on what is in their immediate world and less so the world at large. But, as especially later teens start to think about these things, then, it becomes very overwhelming. And we know that the 18 to 24 age group has actually been affected, really significantly by COVID and has kind of the higher rates of suicidal thinking even.
So important. Thank you. And thanks for, acknowledging my sort of selfish question there, but I thought that was really interesting. Thanks so much.
So these are just a couple of examples of questions on consults. So, this question was around a 9-year-old boy with prior history of ADHD and some disruptive behavior who's already getting therapy, and then a new diagnosis of autism that was confirmed by a formal evaluation, and recommendation was to start ABA, but he hadn't started that yet. There has also been, a request for an IEP and 504 evaluation. And now in the meantime, he seems to have much more anxiety, difficulty sleeping, separation anxiety, and tearfulness, irritability. He had been taking methylphenidate, but it seemed to make the mood and irritability worse. So the family self-discontinued, and the PCP is asking, what medication can I start? Can I start something for anxiety? And so the recommendations from the e-consultant were to do the SCARED questionnaire, which is a validated anxiety rating scale that is good for kids ages 8 to 18. And to really kind of quantify and qualify the symptoms a little bit more. And then that sertraline can be helpful for anxiety, especially in younger kids. And there are easy dosing increments. There's a liquid available. And also that it doesn't taste like the bubblegum flavored or cherry flavored antibiotic. The taste can be kind of noxious. And so those are some just practical pearls. And then, after assessing, having kind of a time frame at which to follow up and to reconsider, trying to address the ADHD as well, because that can also lead to a lot of anxiety. And then links to screening tools like the SCARED and also handouts were included on this. Next slide, please. So then this is an example of a teleconsultation And this was, it seemed to be a straightforward question on the surface around Ssri dosing. So this is a 13-year-old female whose PCP is requesting help with Ssri dosing. Their PHQ-9 depression screening score was high, and they had already tried sertraline up to, this is a pretty hefty, close to the maximum dose. And it didn't really seem to help very much, but she did feel more tired. So then she was switched to fluoxetine, and it was just increased to 30 milligrams, which 20 is usually kind of a standard dose. Should we increase this further? And so in doing a little bit deeper dive in the discussion, the patient had also had really an increase in social isolation and then really significant academic decline since the pandemic. And in asking about any learning challenges, the PCP remembered in that discussion, because she'd been caring for this child for quite some time, that she'd been diagnosed with ADHD at age 6, but at that time, the parents weren't ready to start any intervention, so it was never really addressed. And so now that the parents are obviously on board with trying, more than one psychotropic medication, the recommendation was actually to reevaluate for ADHD, because if you're failing academically, you're going to feel pretty down on yourself and sad. And that may be, the depression was really that she was suffering so much, both from the isolation and also from struggling academically so much. And so looking at, what are the things that could be reassessed and to potentially treat the ADHD through school planning and potentially medication. Next slide. So we're just going to end with this, that sunflowers communicate with each other underground through their root system in order to ensure optimal growth for all of the flowers. They communicate and let each other know which way to face toward the sun and where to potentially have more roots to get more water. And in the same vein, we really want to ensure that we're connecting for care with you in order to ensure optimal growth and development for all of California's children. Thank you.
Thank you so much, Petra and Michelle. And the spread of your program is impressive, that so many organizations involved, and also the fact that you have so many of your team members engaged in this. We're so glad to have you ongoing as part of our coalition and addressing this very important need across the Central Valley, across the state, of course. I welcome any questions from the group. We wanted to emphasize that in order to participate, please correct me if I'm wrong, Petra and Michelle, but clinics do need to click this enrollment link that is in your chat. So if you as an organization need to share this with those who need to submit this request to get enrolled in CAP, please share this link. We've shared this on past calls too. If you're already enrolled, wonderful. Thank you so much. Any details on enrollment that you want to share, Petra or Michelle?
I just wanted to thank Mary Renner for helping to kind of spearhead this behind the scenes and for all the great communication. And then also, I thought I saw Dr. Williams on the call. We just enrolled your very large group of providers and look forward to hearing how it's going.
Thank you so much, Petra. We welcome any questions for Petra and Michelle. Please go ahead and send them in chat. I'll pause for a moment in case anyone wants to unmute themselves and ask a question or make a comment. Okay, well, we're going to be sharing more information on this momentarily here. Petra and Michelle both mentioned the importance of education and many different options around provider education. Yes.
Sorry, this is Delphine. Can I ask a quick question?
Yes.
Great. Thank you so much for your presentation. I don't treat kids, so I apologize maybe for the naivete of this, but are there specific questions or categories of questions that you might recommend as a telepsychiatry, like a more phone-based system versus asynchronous, if there's a choice? I mean, sometimes, we are charting at 9 p.m. and so the best option for us is asynchronous, but if there's actually have you found that there might be a benefit of one versus another in certain circumstances, and what those might be?
Yeah, I can start off. I think this is a great question, and we sort of visualize that e-consults and telephone consultations can be part of consultation almost used in different settings and potentially for the same patient, depending on how things are going. For e-consults, we really think they're probably most appropriate for questions that can be answered but are a little more straightforward. So maybe, for example, questions about, specifically like, is there a correct medication or how to titrate a medication or how to manage a side effect, or specifically if there's a particular resource that's appropriate. And then I think a lot of times, as Dr. Steinbushel was saying, there can be a lot of complexity in the, behavioral health and mental health world that doesn't necessarily exist in other specialties. And so I think if there's any kind of complexity or questions about what's truly going on, then often a telephone conversation is more helpful. We would not turn away any consultation if we felt like this wasn't the best medium. We would do our best to answer. And I think if it's a more complex question that we get through e-consults, we would, encourage you to call back for further guidance, or, we could arrange a phone call after the e-consultation to expand on our recommendations.
Great, thanks so much.
Thank you, Dr. Ritter and Dr. Steinbushel. I think what's so important is and so special about this program is that there are options for providers to be able to engage in two different ways, whether it be phone or asynchronous. So we're so appreciative of the flexibility of this program. Any last questions for Dr. Ritter or Dr. Steinbushel? Well, you get to hear more from them. If your providers are available and interested in achieving free CME, on November 9th, we are offering a course for primary care providers and specialists who are interested in e-consult for behavioral mental health. This is also open if those who are not achieving CME credit but just want to listen in. It's open to you too. It's a free session planned for November 9th, 12 to 1 Pacific, and specifically focused on best practices for e-consult in mental and behavioral health. This is not specific to CAP. So this is open to those who are not participating in CAP also. And we appreciate the UCSF team for all of your support of our group. Thanks again. And since Pedro made a special shout out to Dr. Williams, we're happy to spotlight United Health Centers. We're glad that you got your clinic engaged in this program, in the CAP program, and enrolled. We're so excited that you're able to collaborate in that way. We like to spotlight a provider every month, an organization that's engaged in our e-consult efforts and really making an effort to support their PCPs and getting up and running. So thanks, Dr. Williams and team. I know your other team members might be on the phone today. Karina, do you want to note how we spotlight our providers and how the plans are supporting this?
Yeah, so congratulations to United Health Centers. Anthem does want to provide a lunch to all of you at the providers and referral coordinators, everyone contributing to the effort to utilize e-consults. So we'll be providing a gift card. It's a credit through Grubhub. So I'll be reaching out to you, Dr. Williams, to coordinate the date for that, because there is like a kind of like a time frame of when we can do it. It's either a day of or it's a week time limit. So there's details to it, but I'll be in contact with you and we can set up that gift card so you guys can purchase some lunch.
Thanks. And Dr. Williams will look forward to hearing how the CAP program is working and hear how e-consults and phone consults are incorporated into your e-consult process. Thanks again. So in other news, exciting advancements in our program. We've heard from many of you, and we're so happy that this is a unique program that engages the managed care plans across these counties working together to support your patients. So e-consult, as you know, works better if you can offer it to all of your Medi-Cal patients, which is great that we're able to say that Anthem and Calviva and HealthNet, where HealthNet patients exist, all have access to e-consults. But we've also heard from many of our clinics that they want to have access for uninsured patients. So we're pleased that through a grant from Anthem, we're now able to extend access to uninsured patients across the Central Valley and also across the North State too. Corinne, do you want to say anything about the grant?
Yeah, so Anthem is providing $50,000 to provide coverage for e-consults for the uninsured through ComfortMed. So this is also going to be in collaboration with Mary Renner at Central Valley Healthcare Network. So she'll be actually managing and distributing the funds for all of the e-consults that come through for uninsured over to ConfirMed. So thank you to Mary Runner for partnering with us on this. And we're really excited to see, how we can make an impact for making this available throughout the community. So thank you.
Thanks, everyone. And we will help to get this information out to your clinics so that along with the ConfirMed team, that your referral teams know that uninsured consults are acceptable, that you can send e-consults for uninsured patients, since I know there's probably some training involved to make sure everybody understands how this expansion can support our patients. Thanks again. And on the note of communication, we have heard loud and clear from you all, as we've talked about patient communications, that it would be helpful to have some tools to be able to share the news of e-consults and how they work with your patients. So we've drafted a pretty simple tool. Thanks to ConfirMed for your contributions to this too. How do we talk to patients about e-consult, or explaining to them what is an e-consult? We know from years of talking to patients about this that it often happens without them knowing it. It might be hard for a primary care provider or team to explain to a patient why an e-consult is better for them than seeing a specialist, having to travel, having to take time off work to go to another appointment. So we wanted to develop a simple tool. It could be a leave behind in the patient's waiting room. It could be something that the primary care provider hands to the patient in multiple languages as they leave their appointment, to understand that they may not need to have a face-to-face visit, or they may if an e-consult results in the face-to-face being the best course of action for them. So you're probably looking at my screen. If you have any comments or questions on this, I welcome them. Thank you, Cindy. I'm thinking that Cindy from Omni who's piping in here, but one of the biggest notes on this is we want to make this in simple language. We know patients may be limited in English. We would like to provide this in Spanish too. Of course, it could be translatable to other languages. If we can do that for you, you're welcome to make those suggestions to us. But just want to take a moment. Are there any comments on this? How to make it simple, how to make it easily understood and accessible to patients? Because Cindy commented. Cindy, do you have any comments on how we might make this easily used by patients? I know I'm putting you on the spot. Or any others?
This is Delphine. I'm happy to chime in. Thank you so much for doing this. We did something similar that was more unique to our own health system. So while many of the elements are similar, we had a couple additional elements that were, again, just unique to our health system. But I actually think my point was going to say, one, awesome job. I love the infographics. And number two, we found in our work that the folks that were best poised to identify what is language that is more easily accessible to our patients were our medical assistants, because they are often the ones that are answering questions and helping the patients navigate going from one visit to another. And so if this has not been looked at, or if you have a chance to offer this to some of the medical assistants who work in the programs and see what their thoughts are, I found that they were probably our best, our most value added in terms of feedback.
Thank you so much, Delphine. And those of you who are new to our call, we are so glad that Dr. Delphine Tuo joins us as our advisor. She's with SF General, Zuckerberg SF General in San Francisco, and has been leading eConsult for, gosh, I don't know if I can say 10 years, Delphine, but that might be getting close, huh? Yep. So she's done a lot. We've talked a lot about how do we talk to patients about this. And as we tried to make this more accessible, we thought about language. You know, we understand that this might be a nurse or a medical assistant or a PA or an NP, primary care doctor may be oversimplifying this. There are other words here that, you could advise us on. So I appreciate your input. You have my email. If you'd like to share with your teams, we welcome that feedback. I'll be sending this to you once again for your feedback so we can iterate on it a couple times and be able to send this out to you in a printable format for your clinic team. So one note that we'd like to share on our monthly calls is that we are excited and interested when we hear specialists want to participate in this program. We've had a few specialists, individuals reach out and say, hey, I'd love to participate. Those specialists can get connected with our eConsult platform vendors to be able to deliver eConsult responses, to respond to eConsults from your primary care teams. Some of you do have specialists within your organizations who might want to respond to e-consults, please let us know if they'd like to participate. We know that there is value in primary care providers being able to participate with their referral partners. We also know that for specialists, being able to respond via e-consult might give them the opportunity to really optimize the visits that need to take place face-to-face, answer some of the questions that don't need to result in face-to-face visits. So please do share the news of our program with your primary and specialty care providers to make sure that both are aware they can participate in this program. Lastly, we wanted to share what we are preparing and pulling together different data sources in order to present as a summary or a snapshot of our program. So this is a design of what we're calling a community-wide dashboard. And my colleague, John Weir, I believe, John, you're on. If you want to talk a little bit about the process of gathering data and developing the dashboard.
Yeah, sure. Thanks, Libby. And this is kind of the result of a lot of work that's been going on behind the scenes and with both the health plans and the technology partners on this particular initiative, and to really start thinking about, as a community, all the great work that's been going on as far as people onboarding, utilizing the system, and the benefits of e-consult to both providers and patients. How do we start visualizing that and start giving a view that makes sense for folks that might want to come out and just see what's going on in the Central Valley? So we've put together, and this is a work in motion at the moment, but looking to release these dashboard views where we can start showing just what's the overall volume of consults that's going on in the multiple county area, how many active organizations, and then start taking some metrics from publications to start estimating patient wait days avoided, estimated patient out-of-pocket costs, for example. And then use these visualizations here that you'll see to be able to then view on a per county basis or a global scale just what some of the outcomes and volumes are as far as e-consult utilization. So we've got the specialty demand by month, and so month over month we can start looking at, well, where's the high utilization from a specialty perspective? Is there low utilization in areas that we thought may have higher utilization, and start thinking a little bit about why that may be, and use this as kind of an approach to reaching out to the provider organizations that are participating, and to on an ongoing basis just get feedback on how things are going and what action we might need be able to support as far as onboarding additional specialists or other things that may be going out there. So I have to thank Confermed, for example, for sharing some of the data behind the scenes here, and being able to take that and put it into some of these geo views. If you when this gets released, the e-consults by county will actually act as a filter. So if you click on any given county, everything in the surrounding graphs will change specific to that county, and then you can unclick that and roll up. But hand in hand with the views over time and the e-consult face-to-face versus non-face-to-face visits, and we've also created a secondary dashboard, which we're calling our equity dashboard. And it's really just taking the same set of information and wrapping it around ethnicity, age, and gender, and language to kind of illustrate that there's really no one demographic that's capitalizing on the use of e-consult, that it is spread across many ethnicities and genders. And you can see here, there's a few limitations in the age grouping and how we do that. So the age grouping between 10 and 12 or 10 and 20 is 10 to 19. We're just not able to represent that effectively, but based on some limitations in Tableau, but basically giving you that view for anybody who's looking for supporting maybe a grant, for instance, or creating some papers or study information that might be needed as it pertains to this particular effort. And over time, we look to kind of continue to broaden this out over other counties and start adding that information. So looking forward to getting feedback once we release it, and excited to be able to represent it here. Oh, Libby, you're muted.
Love to open it up
questions?
I'd love to open it up to any questions from the group, and I think this is an excellent tool to be able to work on some of the issues that really were the origin, or that were behind the origin of this project, that we need to focus on health disparities, the challenge in terms of access to care that we face in the Central Valley. And I think this is a helpful glimpse at how our program can impact these challenges. Any comments or questions from the group?
Just a comment, Libby, this is Jeff with Calviva Health. I think the COVID dashboard and the e-consult dashboard that we're working on here is actually going to be really helpful once we start seeing the data come in. I think as we're starting to look into 2022, as we start seeing the timely access requirements get reformulated to see what the new requirements are going to be on the health plan, I think being able to see all of the efforts that's happening within the provider community, seeing real time kind of how e-consult is playing a role, and particularly what particular specialties are having an impact in terms of a benefit for the patient in getting care. I think it's going to really be great both in the provider community and in the health plan community, and responding in terms of how our beneficiaries here in the community are receiving timely care. So I think this project is really a key thing to stay on top of as we proceed.
Thanks so much, Jeff. And this helps us, as we look into this, as we were just speaking to our patient support tools, we can see right here patient language and make sure that we have materials that are appropriate for the patients we are trying to serve. Any other comments?
Yeah, this is Delphine. I can't help but chime in. This is amazing. So props to you guys for putting this together. It's not only, I'll echo what was just said, not only is this a great visual manifestation of all the hard work of all the providers and all the organizing that happens to try to deliver specialty care to these patients. But I love the focus on disparities and race ethnicity as well. I will add one more thought to consider for a future as this develops, and that is some of the most common questions maybe for some of the specialties, like the top 10 or the top 5, particularly if we try to create maybe some CME opportunities for the entire Valley and for the entire network. That might be a nice way to comb the most common e-consult questions as a starting place.
Thanks so much, Delphine. That's a great idea. And we do have those types of questions from our platforms, so that's helpful. Any other questions for John or comments? Thanks, John. A couple announcements before we wrap up today. Please mark your calendars. I think I might have already marked them for you since I put this on the calendars of the group, but upcoming in November is our e-consult work group, our annual meeting. So some of you may have attended this in the past. We have a project supported by California Healthcare Foundation where we meet on a monthly basis. Some of you may have joined our monthly calls. This looks at e-consult at a national and international level, looking to support expanded policy, reimbursement, and provider education and utilization. So we hope that you can join us on November 3rd for all or part of this free meeting. You can register at this link below here, and you'll get reminders by email to register and put this on your calendar. So our featured presenter, our keynote presenter is Dr. Laura Miller, who's from Community Health Center Network up in Alameda. Maybe you've heard of Dr. Miller, who participates and leads e-consult using Rubicon. So so pleased to have a provider kick kick off our session and share the clinical perspective of e-consult. A couple other announcements. As you know, you get a monthly newsletter from us that has published data. So updates on what's happening out there in the world of e-consult. You can access our newsletter by email or go to your website here to see our most recent publications. We have a great paper out on pediatric dermatology from Mass General, and also a study out from Los Angeles DHS around e-consults impact on specialists' effectiveness. So some great publications from this month. And as I think I mentioned before, econsultworker.com has all of these resources for you. Last, just mark your calendars for November 3rd for our annual meeting, and also November 9th for the CME session that you can register for through our newsletter that you received. If you have anyone who'd like to register, I can get them registered personally. You have our contact information here. Thanks everybody for your time today. Bye-bye now.